Good afternoon, everybody. My name is Edgar Wallace, and I am one of the presenters for you today. Welcome you to the TTI Health Show program. We're welcoming you from. I know that we have lots and lots of different countries that are connecting to us. So we'd like to give you a big welcome from me and from the team. My co-host this afternoon is Shirley.
Hello, everyone. Good afternoon or good morning to you all.
And I'd also like you to welcome the YouTube viewers. Say hi again, Shirley.
Hello to our YouTube viewers. Thank you for joining us on YouTube.
Okay. We have a wonderful show for you today. And we have the good doctor with us today. Can I see her? Can she give me a quick wave and hi?
I think she's in somewhere.
She's here. I've seen her. Can you give us a wave? Thank you very much. Nice to see you. We are going to be tackling acid reflux today. And I know quite a few people have problems with acid reflux. Sometimes called heartburn, and I'm not so sure it's to do with the heart, but we're going to get some advice from our doctor today to give us some support with this, and we welcome you to contribute to the program as well. Before we go any further, we're going to do our disclaimer. I'm going to put it up, and I'm going to ask Shirley to read it for me, if you would be so pleased.
That's fine, Edgar. I will do so. Okay, so only a physician can diagnose, treat, and prescribe for illness or disease. Any information disclosed or discussed at the TTI Zoom talk show are for educational and informational purposes only. Please continue to seek professional medical advice from your general practitioner regarding any illness or disease you may be suffering from.
Thank you very much. All right. Now, I don't know if there's anything that you would like to say, Shirley, in particular with regards to this program or any programs coming up. I'm going to give you an opportunity to do that. And then we're going to move on to something else.
Okay, so as Edgar mentioned earlier, we're going to be talking about acid reflux with Dr. Komotso, and future programs that we have will be on right now in the UK or wherever you may be, the pollen and so forth. So we're touching on allergies, and we'll be talking on, we'll be speaking on practical demos. There'll be Barbara, she'll be returning back on a Sunday, and then we're gonna have a weekend special, Saturday and Sunday in June, 12th and the 13th. And I think Edgar will be on children's health. Is that correct?
Correct.
Yes, on children's health on the 12th and the 13th of June. She'll be with us on the 6th of June, which is a Sunday. And then we'll be touching on allergies from other speakers and practicals. Hopefully we'll be able to have our cooking back again, because we haven't had it since, I think, the Christmas special. So hopefully we'll have cooking again on the platform. So different things are coming up in the future and training. So stay tuned with us with TTI as we continue throughout this health journey with you all.
Thank you, Shirley. There's one other thing that I think you missed.
Oh, what did I miss, Edgar?
I'm going to touch you upon. Next week, who is our presenter next week, and what will he be doing?
Brother Floyd Maybury.
Correct. And he's doing...
but what's he doing on? I'm trying to remember the topic, what he was doing.
Influenza?
Influenza, yes.
Okay.
Influenza.
Now, I think next week should be an excellent show. Definitely worth tuning into. And maybe he might even touch a little bit on COVID, because there's kind of a connection there with the flu and problems with your chest and so on. So I think next week should be a very, very good program. I'm really really looking forward to it. Now, at this moment in time, we're going to have our normal or usual testimony spot. So if anybody would like to give a testimony about something that they've done and the challenges that we've set previously, this is an opportunity for you to unmute. And also, Scott, who was our presenter last week from USA, he gave a challenge of not eating 5 hours before going to bed. So that's a challenge. I'm wondering if anybody actually did that and also how they got on with doing it. So at this point, we're going to allow you to unmute and give us your testimony if you'd like to give it. And I think, are they able to unmute as well, Jonathan? Can you just make sure that's the case?
Yes.
Thank you very much. So if you'd like to unmute and give me your testimony and feedback.
Well as her cholesterol, and everything was perfect as well.
And we're not going to prolong this. This is just going to be like a quick thing. So this is your opportunity if you'd like to unmute and give us testimony.
Yes, this is the quiet spot.
Okay, I'll have a go. I did testimony, yes. It's
Oh,
Louise
yes,
here.
thank you, Louise.
Hi.
Hi,
Hello,
Louise.
Hi. I have 2 meals a day. One at 7 o'clock in the morning, and then my last meal is at like 2:30. And that's it for the day until the next day. If I feel hungry, I'll have a nice hot mint tea or drink water. And that's my meal for the day.
And that's you for the day, Louise.
Yeah.
From 7 to 7 and then 2, around 2,
Yeah.
half 2.
Yeah.
And I know Louise is one of our chefs. And Louise, could you give us an example of something that you may have had for breakfast? And then
I make my own granola.
Mm-hmm.
It's all natural and health. That's with all the seeds, chana seeds, pumpkin seeds, and all the seeds you can find, and some nuts. For lunch, I may have something like, if it's the winter time, I have soup, or sometimes I have rice and vegetable stew I make, or something like that.
Okay.
Or sometimes I just have fruit in the morning.
Mm-hmm.
And then have something light in the evening. That's all, especially in the summer. Summer
Yeah.
is mostly raw.
Okay.
Yeah.
Okay. Thank you, Louise, for that.
You're welcome.
Is there anybody else who would like to share with us?
Anybody want to have a go? Anyone that's used to eating maybe late at night and then you took on this challenge to say, okay, I'm going to give myself this challenge and do the 5 hours before bed?
Hello.
Hi.
After watching last week, I started doing the 2 meals.
Mm-hmm.
And mine is like 8 to 9, I'll do breakfast. And then 4 to 5, I have my other meal. And
Okay, yes.
it's been going great.
And it's still going good.
Right.
Oh, that's good to hear. You want to give us an example? Is it like a good portion breakfast and then to keep you going for that till the next the time?
I noticed when I have a lot of fruit and a little nut in the morning,
Okay. Yes.
or a little cover, that will keep me very good. So what I do is that I try to have plenty of fruit, and it's summer now, so we have a lot of fruit.
Yeah, a
And
lot of fruits. Yeah.
yeah, and I mean fresh fruits too. So I'd have a lot of fruits. Then 2 hours after I start sipping my water, and it's been going very good. I was even surprised with it because I'm keeping up okay.
Oh, lovely. That's good to hear. Thank you for sharing that. So one thing I'm hearing from yourself, is it Arlene?
Right.
Arlene and Louise, when it comes to breakfast time and so forth, when you have like a good portion of fruits and nuts and seeds, it keeps you going, and it keeps you going for quite a good while. So you have to really eat well in the morning. So you eat like a king or a queen, eat well to keep you going for that long period. So you don't find yourself snacking in between meals. One of our challenges that we've had in the past, and it was no snacking in between meals. And that was one of our challenges on the show previous. So yeah, it keeps you going once you had a good solid breakfast. Thank you, Arlene, for sharing with us.
You're welcome.
While we're waiting, Shirley, can I just pick your brain?
Oh boy.
two, two people have said about having nuts and fruits and having a good proportion in the morning. Okay.
Yes.
If I asked you if you did the opposite, so you're going to work, you're having a long day, you say, okay, you know what, I'm just gonna have an apple and run to work. Lunchtime, I'm just gonna have a packet of crisps and maybe a piece of bread. What's the impact of that compared with what the other people are doing?
I won't be able to function. I'll be hungry. So it'll be impacting your health. It's just that scenario that we would say sometimes, that if you're traveling far, you always fill up your tank before you travel.
That's
So
right.
it's like your body, you fill up your tank, which is your human machinery, the machinery, to keep you going. So you have to fill it up, and fill it up with good food.
So a lot of times I think a lot of people, they actually don't eat enough. You think, well, oh, but they'll say, well, I'll just eat a little, I'll have just enough to keep me going. But really, they're not having enough food. They need to eat enough so that they can have sufficient breaks in between their meals.
Yes.
That's why the challenge was given last week about the 5 hours. While you're having a break from eating, you can practice having the right amount of fluids, which is going to keep the system going.
Yes, and I think this will probably be a topic. I mean, a part of what Dr. Louise, I'm sure, Komotso will probably talk about when it comes to acid reflux. As it's eating, you're probably going to be eating in between meals because you're hungry. And I'm sure she will talk about that. Oh, you're on mute, Edgar.
Thank you. Before we go to Dr. Louisa, I'm just going to do a quick advert. So I'm going to put up the groups. If you can just talk us through it, Shirley. And then my apologies for the one you sent me. I've not adjusted to change it.
That's okay.
You just do it as we go. So we're going to jump to adverts quickly. And if you can talk us through it.
Okay.
Just one moment. There we go.
Okay, so this screen here is mainly for those who are on our YouTube page, because those who are on Zoom, we will share the link shortly with you all in the chat. For those who are on YouTube, this is our Telegram group. So we have a women's one, a men's one, and a spiritual one, where we come together and discuss about health, if anyone has any issues, where we share information. I know today there was information regarding the herbs that's outside, like dandelion and burdock and nettle. So we just share different health topics or health discussions, or even when it's the challenge that we set, those who may be struggling or those who are taking it on, and And what else do we talk about? That and just different things when it comes to health. That's what we talk about on the platforms. And then even for gadgets as well, those who may be looking for a good juicer or blender or something, or they're need help finding something, then we'll try and see if we can help them, that individual. So if you would like to join, this is the link. So just if you have a URL, type this in. For those who are on YouTube, just type it in. It will take you straight to Telegram. Please ensure that you do have Telegram downloaded onto your phone. So it's like a WhatsApp group, but we went onto Telegram because it was expanding for us. So that's why we've chose Telegram. This one is just us, the ministry, True 10% International, what we do. If those who may feel impressed to give a donation to us, we don't just do this on a Saturday at 3. Well, before COVID, we did training and health classes. Hopefully we'll be able to do that again soon as things are easing. We go out and help those who are sick, consultations, we do training. We also do homeless. Some of us do on a Friday, a homeless project for our website, and also handing out literature. So we do various things within the week, other than this Saturday show program. So other things we do in the week, we also do an essential oil class on a Thursday at 7. Quite a few of us take part in this class, and we talk about essential oils, how it can help when it comes to our bodies, the type of essential oils to use. Thursday gone, we talked about, I did one on environmental health and indoor pollution, indoor pollutants inside. So inside is actually worse than outside when it comes to pollution and toxins. So we talked about that, and we actually did a demo, practical, on essential oils and which what we can use. So we made an all-purpose spray, a toilet bowl cleaner, and a mold one, and an oven cleaner. So these are the ones that we've made for this on this class on Thursday. And this Thursday is not practical, but it's outside threats now we're going to be talking about when it comes to environmental health. So we'll talk about outside, and then the week after will be the practical. So this is the Zoom details. Those who are on YouTube, or those who may be struggling to see it, it's I'm going to read it out. To join, it's 829 9752 4481, and this is 7 p.m. every Thursday UK time. And then this one is Louise. Louise spoke, the first lady that spoke, Louise, herself and Alvin, and they hold a cookery school. I'm not sure if they have it still going on now or if they're finished, but they have a cookery school. And if you just go to their website, you'll be able to get all the information, which is www.goldenpalmscookeryschool.com. And also the contact numbers is there as well. So mobile, it will be 079 58 620 928.
Hello, could you repeat the essential oils joining details, please? You did it rather fast.
Sorry. So it's 829.
Yes, thank you.
9752
52
4481.
4481. Thank you very much.
You're welcome. It's on a Thursday, every Thursday UK time, 7 p.m.
Thank you.
You're welcome. And this one, I'm just going to get the information regarding this. So this one, as you can see, there's some familiar faces on here. So we're just announcing this program for tomorrow. It's starting at 4. and it is a launch of the Association of Health Reformers. So as I said, you're going to recognize some of the people on here that have spoken on our platform, and they will be having a launch tomorrow on the association that they've actually that they're going to start. So it starts at 4, and the Zoom details, I can't really see the Zoom on here. Let me see if I can get the Zoom on my phone. So the Zoom details is 894 432 1359, and there's no password required. So please
I'll leave
join
that
for
up
that
for
before.
I'll leave that up for a moment if somebody wants to take a screenshot.
Please, Charlene, can you repeat again the number?
It's 894 432 1359.
59. Thank you so much.
You're welcome.
Okay, I'm going to stop sharing now. There is a hand, and it's been up for a while, so I'm going to just take this one person's hand, and then we're going to carry on with the program. Rosemary, do you want to? Is there something that you would like to say? Rosemary Wilson, is there a comment that you'd like to make?
Sorry about that. I just wanted to say that I've heard, I just wanted to say that I've been doing some Googling on herbs that can heal people, and I've heard that there are herbs that have healing properties as well, by the way.
Okay, yeah, that's great. Thank you for that encouragement and comment. Right, so now we are going to, without further ado, go to our good doctor who's going to do the presentation on acid reflux, which I'm really, really looking forward to. Dr. Louisa, would you like to take the platform? Dr. Louisa, are you there? There you go. How are you?
I'm all right. How are you, Edgar?
I'm all right. It's really, really good to see you.
It's good to be here. It's been a while. Hello, Charlene.
Hey, Louisa.
Greetings to everyone, and it's good to be here on the TTI platform. It's been a while. Our work doesn't stop, so that's how it goes. Without further ado, I would like to get into today's topic, which is acid reflux. I'm pretty certain that a lot of us have had this experience, and it is really not a nice one to have. As you saw on the poster, it is fire in your belly, but it feels more like fire in your chest, isn't it? And you feel like you're going to die. I remember I used to suffer a lot from this. And one day I had such pain and I went to the doctor, and after that, and I was groaning and crying. And after I got some injection, I went all quiet and my mother thought I was dead. But I was very grateful to be relieved from the pain. So I personally have experience with this, but I know that a lot of people suffer from this, and we've sort of come to believe that it is normal to have this. So I'm hoping that today's presentation is going to help you. As you know, I like to go into details of you understanding your body. That's how I present things before I just give you the remedies. So we will get to that and we will have our challenge for the day. All right, as people are joining in, I will continue. Do you have fire in your belly? Now, what is acid reflux? I thought let us just start there. It's literally a relaxation of a valve, and I will call it that, and you'll understand why I put the word valve in inverted commas. That is at the junction of your food pipe, which is the esophagus, you can see in the picture, and your stomach. So where your esophagus joins your stomach, there's a valve there, and it relaxes at the wrong time. And when it relaxes, it causes backflow of the contents of the stomach into the esophagus. And this creates the inability of the esophagus. It's not able to deal with these contents. The esophagus has different cells, okay, and they're not meant to be able to deal with acidic contents. The stomach is designed differently. The stomach has their cells, has a design. There's mucus there to help them deal with the fact that the contents are acidic, but not so with the esophagus. And then this results in a burning sensation, which goes up the chest cavity. So, and this is what we call as heartburn, because it feels like your heart is on fire, but really it's originating from the stomach and moving upwards. That's what acid reflux is. So we're literally going to be looking at that junction between the esophagus, your food pipe, and the stomach, and see what has gone wrong, because that is not supposed to happen. Okay. Now, what are some of the symptoms? There are many. You will get a burning sensation in the chest, normally after eating, or if you lie down, especially if you lie down soon after eating. Belching or burping. Sometimes people will say that they have a bad breath as well, associated with the belching and the burping. Nausea, okay. Regurgitation of food or a sour liquid, so you feel like something is coming up. The food that you've eaten or the sour liquid, and it leaves a bitter taste in your mouth. You get a discomfort in your upper abdomen. You know, you're holding, it's very specific, you know where the pain is. Or a dry cough and clearing of the throat, or hoarseness of your voice, actually. So sometimes there are people, they keep going, and it's an annoying little cough. It annoys them and it annoys those around them. And you're thinking, why don't you just cough something out? But that's actually the fumes of the acid irritating the back of your throat. And one of the other symptoms can be difficulty swallowing, or a feeling of a lump in your throat, or at any point in your esophagus. These are the symptoms of acid reflux. What causes it? If you look at the picture, let me just hide this so that you can see the picture properly. If you look at that picture, so you eat your food, okay, it goes into your mouth, which is where number one is. Then it goes into your food pipe, okay, into your esophagus. Then there's an upper esophageal sphincter, so the food goes down. You see, it's a one-way movement, okay, until the food passes through, and then it passes at number 4. You see the diaphragm, and number 5 is the lower esophageal sphincter. I'll be calling it LES throughout, the lower esophageal sphincter, okay? And then that's where, so you see that the diaphragm and the LES together allows food to move from your esophagus, your food pipe, into the stomach. That's what's supposed to happen, a one-way movement, okay? But what did we say this acid reflux is? Things start moving in the opposite direction, which is not supposed to happen. So normally food travels one way. Once inside the stomach, this LES together with the diaphragm, it's supposed to tighten and close, okay? Now, anything that disrupts this LES will lead to reflux. So it becomes very easy. Now you have a mental picture of when you have reflux, you know that my LES is not working. All right. So then the question is why? Okay. So we said what causes it. We understand physiologically what has gone wrong, but then the greater question is, okay, but why is that happening? That shouldn't be happening. Okay. Now some of the things. A hiatus henia. This is what when I went to the doctor as a medical student, I discovered that's what I had. A hiatus henia is simply where you have a portion of your stomach is actually above your diaphragm, okay? If we go back to that slide, you see number 4, you see that the stomach is supposed to be below the diaphragm. But then what you see is that there's a portion of it can actually move above the diaphragm. And this is going to cause reflux because already there's a problem with the position of the stomach and in relation to the LES as well. Okay, so I put that one first. And normally a lot of people get operation for that. We will talk about the options in terms of what to do about this acid reflux. Eating large meals or lying down right after a meal. And I'm glad that the Scott's challenge last week was that, don't eat about 3 hours before you go to bed, and don't lie down about 3 hours after you eat anything. So after eating, we always talk about going for a digestive walk. It just helps your body start to digest things, because the sooner the food in your stomach can leave, the lower the chances of anything going up, because there'll be nothing in your stomach, okay, to allow it to go up. So eating large meals, or lying right after eating a large meal. So imagine you eat a large meal and that makes you very sleepy, and then you go to sleep. That's a recipe for disaster. Snacking very close to bedtime will also cause that, because it becomes positional. All right. And you'll see the reason, because your question is, okay, but if there's a sphincter there, why doesn't it just close and stop these things? We will answer that question. Certain beverages like alcohol, caffeinated drinks, and carbonated drinks, what they do is they relax the lower or esophageal sphincter. So when it's relaxed, then it's open, then things inside the stomach can move up. Smoking as well can relax the lower esophageal sphincter, so that's going to end up giving a person a reflux. Abdominal pressure, we call it, it used to be the 5 Fs, I've called it the 6 Fs. So anything that puts pressure on your abdomen will put pressure on your stomach in return, and that will increase the pressure in your stomach to be more than the pressure in your esophagus, and the contents will go out. So what are those things? If you've got central obesity, so you've got a bit of a big belly, if you're fecally loaded, so you're constipated, you're not going to the toilet, all that is going to create pressure in your abdomen. If you're pregnant, okay, because you have a fetus, that's another F, that's going to cause heartburn as well. If you're full of gas, flatus, all right, that can also lead to acid reflux. If you're full of fluid, these are people with ascites. For whatever reason, you've got fluid around your abdomen, that's creating a pressure. And then the last F I added is fashion. You know, there are things that we wear. We wear clothing that is tight. We wear belts that are tight, and that's creating a pressure on the stomach, you know, and the pressure is transmitted backwards into the esophagus. So that can also cause acid reflux. Certain medication, your aspirins, your ibuprofen. I know a lot of people, you have headaches, you've got pains, you've got whatever, and you're taking these things, they can cause a damage to the esophagus as well as to the stomach itself. Okay, muscle relaxant, because LES is a smooth muscle. The lower esophageal sphincter is made of smooth muscles. So if you're taking muscle relaxants because you know, you've got muscle spasms, they're not going to be specific. Not always, okay? They're muscle relaxant, especially those ones that work in your brain. They're going to they can affect your smooth muscles as well as your striated muscles. So that can cause relaxation of the lower esophageal sphincter. And you're wondering, but I'm not eating, so I'm not doing this and I'm not doing this. Check your medication. And blood pressure medication as well can cause acid reflux, okay? And then certain foods, fatty foods, spicy foods. I remember my doctor telling me to stop eating chocolate and drinking wine. And I said to him, that's never going to happen. And some of us were listening here today, and that's what we're saying. But at least you've got the information, so that when you're ready in 3-5 months or a couple of years to give up those things, hopefully permanent damage will not have been caused by then. Since then, I have given up the wine. I dabble in the chocolate a little bit when I can't find carob, but I do know that there are consequences for every choice that we make. So reflux will come. Citrus will increase acid reflux already for those people who have a problem. All right, garlic, onion, and tomato. So we will look at those things as well. So now, how is it diagnosed? Well, you can look at, and it's important to be able to diagnose things, and you will see why. Last week, Scott was talking about chest pains and heart issues. You know, it's called heartburn because a lot of people get afraid thinking that, is it a heart issue? So the right diagnosis must be made. So your symptoms can be are important. So you'll go to your doctor, or you will realize in yourself that, you know, what I've mentioned, that the dry cough, the hoarseness, the feeling of a sour sensation of things coming up, burping, belching, fire in your chest, all of those things are your symptoms that can, you know, get one thinking that what they have is acid reflux. But there are investigations that a doctor can do. Now you're wondering, okay, why do I need to know this? You can actually go and ask for some of these investigations. You can ask your doctor. I don't know about in other countries, but what we try to do as TTI is to empower you to know the tools that are available. There's a barium swallow, which allows you to see if there is a reflux. There's an endoscopy. There's a pH probe test and esophageal manometry, and I will briefly go into these. And especially for those of you here who are medical missionaries, you know, your patients may come with these things, and therefore it's good to be able to understand. But even for you, when you go for these tests, often you're given the envelope and you just take it back to your doctor, have a look and see. And that's what I'm going to show you, because this is what's happening in your own body. All right. If you look at the first picture there, you see that white. This is an X-ray that is done. The bones at the back are your spinal cord. So that white pouch is the stomach of somebody who was given a barium meal. So they're given something to drink, and it comes white on the X-ray. You can see that it ends very nicely. Okay, so the meal is filling up the stomach. But you look at the second picture, you start to see that after some time, because they take the picture in time. So they wait until it has emptied from the esophagus, then they take pictures. Then it starts to creep back up, as you can see. So in the picture in the middle, you can see that this meal now is going upwards, which is not supposed to happen. And you see in the third one that it's actually even trapped there. You see that there's a little bulge and then there's a closing there. Okay, that this is what we would see if we did a barium swallow. It's a very simple test to do. You just go to your lab and they give you something and they take the pictures and they give you the pictures. Often they give you a report. You'd be able to read it. We need to become knowledgeable about our own bodies. For the men who are here, you know, you're always knowledgeable about the car, you want to know, and you're taking it apart. Get knowledgeable about your own body, okay? Speak to your doctor. Don't just take things. Ask questions and see, so that you can have an understanding. There's also what we call an upper endoscopy, where you want to look down and see what is happening in the esophagus. If you look, so they put a camera down your mouth while you're sedated, and then the doctor will give you a picture and look at it. Often people don't look at it because they assume that it's only for doctors. But if you look at this picture in front of you, you can see that, okay, you can see the normal healthy esophagus. It's nice, it's pink, it's smooth, you know, it just looks like the picture of health. Now look in comparison to the other one. It's red, it's inflamed. This is because acid has been on it and it has caused damage. Okay, so it is really not very difficult. I have seen these pictures. We had a lady who came in and she had diffuse meaning it was all over. Her esophagus and her entire stomach was just bright red. I even showed her the picture. She had never looked, and she said, well, this doesn't look right. It just looked raw. And this is what the acid does. So upper endoscopy would be able to not show you the reflux, but it will show you the effect of reflux. Because remember I said, the acid is supposed to be in your stomach, but if it starts to go up, it causes irritation in your esophagus, because your esophagus was not designed to deal with acidic food, well, that has been combined with the acid from the stomach. Remember, the acid from the stomach is pretty strong. It has a pH of about 2 to 3. All right, so that's hydrochloric acid. It can cause that kind of damage in cells that were not designed to deal with it. All right, and then there's also a pH probe test. So it doesn't look very comfortable. Your doctor will put a flexible tube down your throat. Okay, you can see in the picture there, it doesn't go into your stomach. It remains in your esophagus, but right at the bottom. Okay, and then what it's going to do is going to sense the pH. So you'll keep it for 24 hours and it'll be able to tell you what your pH was like. So after a meal, when you hadn't eaten, when you were sleeping at night, and then it's recorded, you will have a little monitor tied to your, you know, on your chest or on your belt at your waist level, and it's going to record all of that. So that is a very good test. You would know for sure that it is acid reflux that you have. And then the other test is esophageal manometry. Esophageal is just your pipe. Okay. Now, manometry, this is the diagnosis of problems of movement and pressure. All right. When food moves down your esophagus, it is the strongest force ever. These muscles, I don't know if you can see me. These muscles, they literally constrict one after the other, pushing the food down. It's been said if you were to stand on your head and swallow food, it will still go into your stomach. That's how strong the force of these things are. I don't recommend that you do that. And it's moving in one direction. So what happens here is that a flexible tube is actually inserted also into your system, and then you just lie down and you'll be asked to swallow, and you'll be also given water to swallow, and the pressure is measured. Okay. And then you'll see that with a healthy esophagus, there's good pressure there at the lower esophageal sphincter. The muscles are able to constrict and close that. But if there's an abnormality of how the muscles of the esophagus move, okay, then it's going to create a problem, and that can be picked up. So with acid reflux, remember we said that the lower esophageal sphincter relaxes. You will find that the pressure is not enough, and so it's not closing well enough. It's creating a gap. It's relaxed too much, and the reflux is able to come back out. And therefore, you would know for sure. You would have a proper diagnosis and know that I have acid reflux. And what are some of the complications of having acid reflux? Before we go into the complications, there was a slide. Anyway, I'll come back to it, I guess. What are the complications of acid reflux? Can you believe it can give you adult onset asthma? All right, because you're inhaling these acidic fumes all the time. It causes irritation, especially if it can go into the lungs, if you can regurgitate. Remember, you actually have these contents and they are liquid. And they can go back up. So that can be a very dangerous condition. Sinusitis, what are these? This is just inflammation of the systems that are affected by the acid going in the wrong direction. So you have esophagitis, which is inflammation of your esophagus. Why is your esophagus inflamed? Because it's irritated by the acid. It's not supposed to be there. You can get sinusitis. You can also get asthma. If the acid is continuous and it's strong, you can actually get bleeding and ulceration. If this happens, often the person will be vomiting or coughing up blood or vomiting blood. But if you swallow the blood, then you can have black stools, okay? That is one of the serious complications of esophageal reflux over time, especially if you get it more than 3 times in a week consistently. Then it's going to create these problems. A lot of us, once in a while, we suffer from it because we're stressed, or we ate wrongly, we ate and we lay down, we were too excited, we ate a big meal, so once in a while, it is not an issue. Your body is able to recognize and deal with it, okay? But if consistently, more than 3 times a week, you're having these symptoms, you are at risk of having these kind of complications. And that's why this presentation becomes important, so that you know what to do. If the ulceration continues for a long time, there'll be narrowing of the esophagus, okay? Because there's damage that happens. It's like the acid eats away, and then the body, in trying to repair the scar tissue that forms, and then your esophagus closes down. So the person will feel like food gets stuck right there at the bottom when they're trying to eat. And if this continues, it can lead to what we call Barrett's esophagus, which is the cells there at the bottom start to change into a precancerous lesion. And if it continues, it can lead to cancer. So if you remember, I think when we did a cancer presentation, me and Jason Williams, we spoke about the 7 stages of disease. Stage 4 is inflammation. You see, this is esophagitis, is inflammation. Then after that comes ulceration. After ulceration comes induration. After induration comes cancer. So you can clearly see this with when the acid is constantly irritating the esophagus, that it's inflammation, ulceration, the stricture, which would be your induration, and a precancerous lesion, and then cancer itself. will follow after that. So this is why it's important. So it's not that because you're feeling uncomfortable. You know, some people, they feel uncomfortable and they just deal with it, or you just deal with the symptoms. You take something for the pain. Remember, painkillers don't treat the problem. Painkillers just stop. Let me rephrase that. Pain is your body's warning system. Okay, it's like the light on your dashboard of a car going on. If you take a plaster and you cover that light, you have not stopped the problem that's ongoing. You have just shut down the warning system. So pain is a warning system. I'm not saying live with pain, but I'm saying it is better to deal with the cause of the pain until the pain goes away, rather than to take painkillers and think everything is okay while the damage is continuing. So be careful, and remember, a lot of the painkillers can contribute. Your ibuprofen and the, yes, the other one, I forgot the name, but you remember what I'm talking about. Now, I am a medical doctor, but this is a different kind of show. I'm going to talk to you about unconventional treatments, not the typical what your doctor would do. If you're looking for conventional therapy, please consult your doctor, your physician, or your gastroenterologist for that. If you want a diagnosis, please consult your doctor, your physician, your gastroenterologist. People, I need to be able to say this to you, yeah? A lot of you come to the doctor and whatever the doctor says you do. But a lot of you go to the mechanic and you listen and you check your own car and you decide, no, I don't think so with your car. But with your body, whatever we say, you do. In most countries, you have an option as to the kind of treatment you should be able to have. So when it comes to diagnosis, I don't often have a challenge with the medical system. But where we part ways is when it comes to how treatment is going to be instituted. Because a lot of people, I know people who were on medication for acid reflux for over 10 years. That means they are not being treated. The cause is not going away. So they're going to be on it for a lifetime. And remember those complications that come if you don't treat it. So these people were well on the way of having esophagitis or cephal ulceration, narrowing, and precancerous lesion, and then ultimately having cancer. Okay, so people are living on antacids. A lot of people, I've seen patients that have been in for surgery. This is not what we're going to discuss. We're going to look at unconventional treatments. For those of you who are here and you're unconventional and you want a way to, one, hopefully reverse your condition, and two, to use the most natural things that are going to cause as little harm as possible. Because if you look at the insert of your medication, you will see that a lot of things have side effects. Some of the medication that's used to treat this are antacids, are things that stop your stomach from making acid. But remember, you need that acid to be able to digest protein. You need that acid to kill bacteria from coming into and stop it from coming into your system. You need that acid to absorb vitamin B12. So if you stop your body from making acid, you won't have reflux, yes, but you're going to have other conditions. So we don't want to change one form of disease into another. So we need to go to the source and treat the problem. And that's what we're going to talk about, our unconventional treatments and therapies. What are the principles of management? I want you to understand what you're doing when you're treating yourself or when you're making recommendations to somebody else, okay? We must do things with understanding. A lot of the times we just tell a person that stop eating oranges. Fine, they stop eating oranges, but a lot of the other things have not been done. As you can see, there are many principles. You need to find the correct diagnosis so that you know that you're treating the right thing, okay? There's nothing worse telling somebody to do something and they say, I don't feel better, but they actually did not have acid reflux. They had, it was actually an anxiety attack, or it was a heart attack, God forbid, or it was gastritis, which, you know, the treatment may be different. So you need to make sure that principles of anything when you're managing, have the right diagnosis, assess the severity or if there are complications. If it's very severe, even your management has to be severe. If it's mild, then your management is also going to be mild. So that's important. Identify the cause or causes. Often things don't have just one cause. You saw that. There are many causes. Then, so that the first three, you're just kind of doing an assessment and identifying. You're like a detective, all right? Then when you start, you must first remove the cause, okay? Because the acid is irritating, but what causes the acid to be irritating? As medical doctors, what we do is like, okay, the acid is the problem, but the acid is not supposed to be there. So why is it there? Let's go beyond and find out why is the acid there. And then you find that this person is smoking. So what they need to do is stop smoking. And then they're like, well, I can't stop smoking because I'm stressed. Okay, why are you stressed? Okay, I'm stressed because I don't have a job. So that's what I mean. You need to remove the cause and not just deal with the symptoms. Okay, because you can stop them from smoking and then they start eating cheese and then they gain weight and then the acid reflux comes back and they're like, I stopped smoking, I started eating, cheese is full of fat, it's going to make them obese, that's going to create a new problem. Do you understand? So you have to be holistic in how you deal with this thing. Identify the cause, remove the cause, avoid anything that makes it worse. So there's nothing wrong with tomato, there's nothing wrong with pineapple, there's nothing wrong with a lot of the foods that we're eating. But for that person who has acid reflux, for a while, those things make the symptoms worse. So you would want them to avoid. The patient that I had that had a severe form of this, we had to restrict so many things. Literally the only fruit he could eat was a pawpaw, all right? So, and she did that for a while. Pawpaw and oats was all she could eat for breakfast. For a long time, and she was fine with it because the pain was so severe. Like I said, she had diffuse gastritis. Avoid exacerbating factors, then heal the damage. Often when we talk about changing the lifestyle, because this is what TTI is about, you know, those 8 principles, we don't actually implement the healing process. We just change our foods, but the damage is still there. Ensure that you heal the damage that has been caused. Help the body to restore functionality. What did I say the biggest problem is? It's that the lower esophageal sphincter has become relaxed. So we want it to become tight again so that it's able to work and create that pressure, okay? And then maintain a healthy state. Don't get to a point where now you're fine, you don't have acid reflux, and then you go back to the things that cause your acid reflux, because then you're going to end up in the same situation again. And the reason I highlight this, even though it seems like a common thing, is because a lot of people say, so when we're done, can I go back to eating my chocolate and drinking my alcohol and smoking? Is that what the cure means? No, what caused it were those things. So if you go back to them, the condition will come back. It's important to understand that. And I found that some people struggle with that because unfortunately we get addicted to things that cause us harm. All right, so let's look at that. Correct diagnosis, because these are some of the things that can look like acid reflux or esophagitis. Now you're thinking, but esophagitis can be a complication of acid reflux, but also esophagitis can be because the person is drinking something that is harmful, is causing inflammation to their throat. So it is not necessarily coming from the stomach, but it's coming from something that they're drinking. So in this situation, what you will see is that they will have esophagitis. They'll have inflammation of the food pipe all the way from the top to the bottom, to where the stomach is. But with acid reflux, the inflammation will start from the bottom and it will be moving upwards. Does that make sense? So it's important to have the correct esophagitis is not the same, and it's not always caused by the same thing. It's not all caused by acid reflux. Maybe they're drinking something that is too strong. Okay, gastritis. Gastritis is simply inflammation inside of the stomach. Okay, so it is not necessarily acid reflux. Okay, coronary artery disease, I think that's what Scott was discussing last week. So a heart attack, because like you said, heartburn will feel like a heart attack. So make sure that it is not that. So if you're not a doctor, have the person go to their physician and have the right diagnosis, because you don't want to be treating heartburn. Kanti, this person is having a heart attack. You're thinking, but a heart attack is very obvious. Not so in diabetics, okay? Diabetics, because they've lost a lot of their sensation, they can have a silent heart attack or a very mild heart attack. So it's important that the correct diagnosis be made. It could be cancer of the esophagus, okay? So it becomes important. So an endoscopy would be able to see that, yes, there's that lump, there's actually a physical lump that's right there. And then there could be motility disorders, movement disorders. Remember, the esophagus is a tube of muscles that squeeze. So that could be the problem. And the lower esophageal sphincter is actually made up of muscles. So management would be different depending on what the cause is. For those who are joining just now, welcome. We are talking about acid reflux. Acid reflux, which is a movement of stomach contents which are acidic from the stomach into the esophagus, which is not supposed to happen because we have a sphincter there, the LES, the lower esophageal sphincter, which is supposed to keep a separation. Food is supposed to go down the valve down the esophagus in a one-way direction. Okay, so we're now looking at principles of management. Number one, make sure that the diagnosis is correct. We looked at different ways, look at the symptoms, and if they can get a barium swallow or an upper endoscopy, or a pH probe or the esophageal manometry, they can go to a doctor and get those, and then you can go home with the results and say, okay, for sure, this is what I have. What do I do now? I have the correct diagnosis. Once you know your diagnosis is correct, then assess the severity and the complications, because it may need specialized treatment. So for somebody who has that precancerous lesion already, you need to deal with it. Somebody who has sinusitis because of it, somebody who has the changes to the esophagus. So we need to determine the severity and the complications so that we can determine how aggressive our intervention needs to be. Like I said, that woman who had it everywhere, she was just red in her stomach and in her esophagus. Her intervention needed to be aggressive so that she does not develop any further complications. And then also don't forget to treat associated conditions. Like this person has a cough, this person has sinusitis, treat those associated conditions so that they don't create other problems as well. Okay, now we said correct the diagnosis, make sure you have the correct diagnosis, assess the severity, then identify the cause. Why do you identify the cause? Because you want to be able to do away with whatever it is that's causing it. Now, this is where the lower esophageal sphincter, it's not a physical barrier. If you went down with a scope, you are not going to find this barrier that you see, and you won't find the muscles that are thick there. Okay, it's more of a pressure barrier. I will show you a picture where the muscles literally just tighten and close things and then they relax. But when you look at it, you would not be able to pick it up. Okay, so the principles is that if there's an incompetence there, and the diaphragm, if it's not strong enough, that will cause relaxation, and that will cause a movement of the stomach itself. That's a terrible thing, or of the stomach contents to go up. Some of the causes can be dysfunctional muscle tone. Remember, I said that the esophagus is a muscle tube, and there could be dysfunction of coordination because it's controlled by nerves and neurotransmitters. So there's nitric oxide and acetylcholine. Now, the reason I put that in there, you know that nitric oxide, we talk about it when we talk about erectile dysfunction and high blood pressure, because this is made and it causes relaxation of smooth muscles. So this is important. And if you're smoking, this is going to affect this. So you need to understand that there are chemicals that the body makes that help with the control, with the relaxation, and with the tightening of this lower esophageal sphincter, but it needs to have these chemicals, okay? And these can be interfered with. Caffeine can interfere with these things because caffeine actually affects acetylcholine levels, okay? Stress will affect this because stress releases certain neurotransmitters as well. So these are the things that we need to understand, that there's a chemistry going on. And then when the acid moves from the stomach into the esophagus, it creates damage. And then this damage causes further weakening of the lower esophageal sphincter. And then more acid comes up, and then more damage happens. Then more acid comes up, more damage happens, and so on and so forth. So it becomes this vicious cycle. That's why people can have it for 10 years. unless you find and identify the cause and put a stop to it, people will be on medication for life and end up with complications. That's why I'm going into so much detail. Now, this is what I want you to see. It is a very beautiful structure, okay? So you have these muscle fibers. Maybe you're not interested, you just want the remedy, but I want you to understand what this is like. You have these muscle fibers that tighten. You can see it's almost like shoelaces, okay? They tighten to clasp and to, to cause a string, a sling. It's called a clasp and sling fibers. So that's how it closes and that's how it opens. So these muscle fibers are important. That's how the sphincter works. You will not see a physical barrier. Okay, so these muscles need to be working fine. And this is why if you're on muscle relaxants, I know a lot of people are on muscle relaxants because they're struggling to sleep, they've got tension, so they take the muscle relaxants for their muscle, for their upper back muscles, not realizing it's going to affect these muscles' ability. So your muscles will not be able to contract. Remember, you need your lower esophageal sphincter to be able to contract. But if you're taking these muscle relaxants, it's going to interfere. Okay. If that fundus is above, you see in the picture, if it's above the esophagus, that's what we call a hiatus henia. Okay. If you eat a large meal, this will not be able to happen. It will not be able to close. It's like if your shoes are too big, you can't tie your shoelaces, so you have to leave them open. Does that make sense? If you lie down after a meal, you cause pressure, so it will be like in a relaxed state. They will not be able to tighten because that section needs to be empty. Okay, the things that we drink and smoking as well will affect the muscles' ability to contract. So it will be relaxed and things are going to move up. Certain medications, certain foods. Pregnancy as well. Pregnancy is twofold, like the abdominal pressure. Pregnancy will cause abdominal pressure, but pregnancy, you also release hormones that cause relaxation of smooth muscles. Why? Because your uterus is supposed to be growing and your muscles are supposed to be loose so that, you're getting ready. You need to be able to accommodate the growing child, and later you need to be able to give birth. Okay, so that's what happens with pregnancy. So you need to know what to do in a pregnant state because you're likely to end up with acid reflux. So you make sure that you don't eat large meals, you don't lie down after eating, you don't drink certain things. You definitely don't want to smoke ever, but you don't want to smoke worse when you're pregnant. You don't want to be on certain medication. You don't want to be eating certain foods when you're pregnant because you're already at risk in terms of pregnancy. Removing the cause, well, you can't remove pregnancy, so you just wait for your pregnancy to pass, but deal with your hiatus henia. If you start learning to breathe properly, okay, your diaphragm will be able to come into its right position. Remove the cause. Stop eating large meals, stop overeating. Okay, eat until you are just almost full so that there's space when your stomach needs to churn the food, and there's space for the muscles to be able to contract. Like I said, putting a big foot in a small shoe, you will not be able to close the shoelaces. All right. So don't have large meals. Eat until you're just about full, but not fully. Don't lie down after a meal for 2 to 3 hours. That was the challenge last week. If you didn't do it now. All right. Let's stop drinking fizzy drinks for many reasons. Including now in the time of COVID. We know the effects that they have. Let's stop drinking alcohol, okay? If you're smoking, please get help. Go on an anti-smoking program because you're causing damage in so many other ways. This is just one small part of what smoking is doing to your body. If you have increased abdominal pressure, if you're pregnant, like I said, you'll give birth, that will go away, but you need to go on a weight loss program if that's necessary. If you're constipated, you need to make sure that you're regular in terms of your bowel movements. If you have gas, you need to know how to get rid of the gas, and be careful. Sometimes it's because we eat in a hurry and we're gulping down air and we're talking and eating at the same time, okay? So we don't want to create extra abdominal pressure. All right, so remove the cause. I will get to the remedies, but please make sure that you remove the cause. Avoid exacerbating factors. So you could have one thing and then you exacerbate it with other things. Just remove the cause and avoid certain foods. So you will want to avoid your tomatoes, anything that makes it worse. You will know you're healed when you're able to eat those things and they don't affect you that way anymore. That's how you know that you have gone back to how you were supposed to be. All right. Then you want to heal the damage, as I said. How do you heal the damage? Well, firstly, you start with the foundational principles. Apply new start: nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God. Trust in God, because it helps to reduce your stress level when you know that you're not dealing with the challenges of life and the world all by yourself. You're not in this COVID situation all by yourself. You reduce that. So apply those health principles, because your esophageal problem is not an isolated problem. Your body works together as a whole. So when your whole body is healthy, things work better. Okay. One of the things you can also do to help heal the damage or to relieve the pain is to drink charcoal. So you take it's better in a powder form than in the capsule form, because remember, it's in your esophagus and you've got inflammation there and you feel like you're on fire. So you take about 2 tablespoons of charcoal in a glass of water, you drink, and then you wash it down with another glass of water. Remember that charcoal can have a constipating effect. So if you're going to do that, try not to do it for more than 3 days. Otherwise, maybe add some psyllium husk to it to avoid yourself from getting constipated. Remember, constipation can also lead to pressure in the abdomen, which can lead to acid reflux. So you don't want to do that. Aloe vera is very good. It's got that gel-like, it's called mucilage, which helps to coat the inside. All right. We put this patient on aloe vera water. That's what she would drink, and it just started dealing with the inflammation. Remember, it's fire in your belly, or in your chest rather. So it starts to cool down your inside. So you may want to scrape the inside of the aloe vera, blend it in water, and just drink that on a regular basis. Slippery elm as a tea is something that you can also take. Remember, I'm saying as a tea because if you take it as a capsule, it's going to become undone in your stomach, but your problem is at the junction of your esophagus and the stomach. And don't drink it too hot, any of these things, okay? You want to drink them lukewarm. Cayenne pepper and peppermint tea. Cayenne pepper actually has healing effect on inflammation, but if your condition is very severe, you may not want to start there because you may not be able to tolerate the burn. All right. Mixing turmeric with coconut oil into a paste and eating it. That also turmeric has an anti-inflammatory property. So does cold pressed coconut oil. Drinking freshly made carrot juice without any preservatives. Okay. It has that effect on the body as well. Eating oats, it has that slippery and slimy characteristic, and it's anti-inflammatory. It definitely helps. This patient, I think for about a month, the only cereal she ate was oats, but because she had such severe pain, she was fine with just being on that. And eating pawpaw as well. This will help to heal the damage, especially the esophagitis. Remember, if you're not having irritation and inflammation, you allow your lower esophageal sphincter to not become any further damaged, okay? And then the last thing you want to do is you want to maintain a healthy state. You want to make those lifestyle changes, but you want to be consistent to allow the body to do its work of restoration. You know, a person has had acid reflux for 10 years. We do this program today and we tell you what to go and do. And then next week you come back and you say it didn't work. That's only 7 days having had a problem for 10 years. So that's why I present the how the body works and the science behind it, so that you know that, okay, that actually makes sense, what is being presented. Now be consistent to allow the body time to do the work of restoration. Remember, you want to repair that muscle, you want to repair the esophagus, you want to deal with all the damage that has been done, and that is going to take time. So lose the weight, stop the smoking, watch the food that you eat, sleep in a position that does not allow reflux. Make sure you don't eat for about 3 hours before. Drink your water about 2 hours after your meal to encourage gastric emptying, okay? So those are some of the things you need to do. I believe I have come to the end of our presentation. Because I'm going to stop sharing the screen, I will share the challenge now before we take any questions. So the challenge for the week is to drink, I still believe, continue with what Scott said. It wasn't just a challenge for a week. It's actually supposed to become a way of life, that you don't eat for 2 to 3 hours before going to bed. Okay, so that you go to bed with either an empty stomach, or what's in there is liquid and it's moving already away from the stomach into the rest of the intestines. So drink slippery elm tea 1 to 3 times a day for the next week. How will you know how many times? Well, if you don't have acid reflux, then you may need to just drink it once. You can drink it in the evening before you go to bed, or you can drink it in the morning. If you suffer from constipation, it will also help. It has that mucilage property, so it helps to coat the inside, and it puts out the fire in your belly. But it's also a high source of calcium, and you know that a lot of these antacids have a calcium, and that's because the movement in terms of how cells work, they require calcium. So that's why there's a scientific reason for that. So drink slippery elm for the next week, but also that's the challenge. But if you found that you have any of the predisposing factors or reasons why you have acid reflux, then implement that into your life consistently for good health. Thank you so much. I hope that was helpful. That is what I had to share with all of you today. Charlene and Edgar, I will hand back to you to facilitate in the questions.
Thank you very much, Dr. Louise. Excellent presentation. I'm sure there are a few questions. I know that some questions have been answered in the chat. So if there's anything, if anybody wants to put questions in the chat, they can still do. And we'll try and do that. But we'll take some live questions as well as the questions that I see on the chat. So if you have a question, if you can put your hand up, please make your questions brief so we can answer as many questions as possible. And also, it's not a consultation. We don't have time for that. I'm sure the doctor would agree with that. And we'll see what we can do, okay? So I've got Jacqueline, your hands up. If you ask your question, please make it brief, please.
Oh, hi, thanks for taking my question.
No
fantastic presentation, well presented, excellent work. Just a quick question. I just looked up, what symptoms and things was caused. And one of the things, and some of the things which you're not allowed to have, and it said onions, garlic, tomato, but it also said peppermint. But then the doctor just mentioned peppermint. Can she expand on that, please?
All right. Like I said, when you look at the severity of the condition, you will be able to know what you can and you can't take. All right. So if when you take peppermint, it affects you negatively, then you would want to stop taking it. So that's just because peppermint helps in terms of your digestive system. So that's why it's added there. But because it can have a relaxing effect as well. If your condition is severe, then it may add to that. So you would want to do away with that. It depends on the severity of your condition.
Great, thank you for that, doctor. Can I just add to that very quickly? Can I just mention, again, I'm allergic to tomato, onion and garlic, and peppermint sometimes bloats me up a little bit. Could that possibly, if I thought it was high histamine, so I'm not getting any burning feelings. I'm just wondering, could that be a possibility of having, the situation in terms of what you just explained, or would it be something, I'm just wondering what's the condition. It seems quite strange. I'm not getting no burning sensations.
Yeah, it could be something else. So if you want to exclude, that's why I said correct diagnosis is important, and I'm glad for that question, Jacqueline. If you want to exclude acid reflux, you can go to your doctor and have any one of those checked out. If when they do an endoscopy or a barium swallow, they don't see any reflux, then that's not your condition. So you're treating the wrong thing, and therefore you're not finding any relief. it's always important. I see people going on natural remedies and they say, this thing doesn't work. But then when I evaluate, I'm like, but that's not the condition you have. So you're treating the wrong thing and that's why you're not having. So if you're having bloatedness, your problem may be further down in your digestive system, like maybe in your small bowel or in your large bowel. So that's a correct diagnosis, and your physician may be able to help you with that.
Great, thank you so much.
Pleasure.
Okay, Shirley, could you monitor the chat? And if there's something that you want to bring up from that, just let me know.
Okay.
I'm going to go to the next question. I've got Priscilla.
Yeah, Priscilla.
Priscilla,
Yes.
would you like to answer your question, please?
Thank you. It's a very good presentation, doctor, and I really like the presentation, very informative. My question is this: now this is the COVID situation. Without going to doctor, is it possible to check for ourselves first? Okay, maybe use the remedies what you told us first, and then if we are getting better, we can continue with this before we go to doctor.
Yes, I suppose you can check for yourself. There's simple things you can do. One, you can eat a tomato and see how it treats you. You can eat a pineapple, see how it treats you. You understand? Then you're like, okay, I'm getting a bit of reflux here. I'm feeling a slight discomfort. And then you treat yourself and you see how you respond. And then you will realize what condition you have. So that's a very good point to mention now that going to the doctor is not so easy.
Thank you so much. Actually, that's what I'm experiencing now. I have eaten tomato and my acid reflux has increased. And then I realized that, okay, I should stop eating tomatoes. I think I will work on it and I'll let you know about it afterwards. Thank you so much, doctor.
All right, pleasure. You may have a combination. Sometimes, you don't have just one condition. If you have acid reflux, you may end up having gastritis. So you may have those two conditions, and therefore you would want to treat both of them simultaneously and see. So the slippery elm drinking would help the inflammation in the esophagus and in your stomach. Then you avoid those things, even though they're good for you for a while until you get well. You eat your pawpaw, you eat your oats with plant-based milk. Remember, you don't want to be using animal milk.
Thank you.
And then you will see as you move along.
And one more question though. Now, suppose if your abdomen is bigger than or more than the size of your stomach, so how to get rid of that? Is it any possibility? Because
I didn't hear your question.
Now, the size of the abdomen, say our belly, suppose the belly size is higher than the stomach, okay, or higher than the TES, right? Then you said acid reflux is possible. Now, how to deal with this?
If you have a big belly,
yes,
you need to lose that weight and that fat. So that's where New Start comes in, because when you go on a plant-based diet, it's been shown that it's effective in terms of weight loss. You can do some research on it, and I think we've probably presented on it as well on TTI.
Okay, actually, I don't have a big belly. Now, what happened, when we are working with these laptops and all, the radiation affects us. Now, yesterday I went to my doctor. My doctor said, your lateral colon got inflamed. I was surprised because I'm very careful about my diet and I do water and I clean bowls every day. But still, but how to help myself with this inflammation of this colon? Is it a cause because of this acid reflux or any other reason behind it?
No, your colon is far from your stomach there. So do the slippery elm challenge. Remember, I said that it helps the entire digestive system, and it helps also with that. But you need to speak to your doctor to try and identify. It's always good to identify the cause of the inflammation.
Thank you so much. I will try first what you said, then I will go afterwards.
All right.
Thank you. Bye-bye.
Pleasure.
Thank you very much. Now, could I just repeat that we're not giving consultations, and the question should be one question, not a question that turns into 4 questions. So if you can be very brief. The next person, Grace, could you answer your question?
Did you say Grace?
Yep, Grace, yeah.
Yes. Hello, doctor.
Hello.
I've been listening and it's very informative. Thank you very much. I've been suffering for a while with just having a lot of wind, but it pushes against because I have sort of like AF, and it actually pushes against my upper, I don't even know what to call it. It's my upper part, and it pushes against my heart, I think, and it will trigger it off. Now I have been having like 2 meals a day. I went to Lucille's Manor House, and I spent 10 days there, and just redoing my whole eating activity, and it has helped me quite significantly. However, I'm still having this wind, and sometimes when I don't eat, and I don't eat from like say 3:30 is the latest that I'll eat. The next day I'm really, really windy, and I'm just wondering. I have been losing weight, and I'm just wondering what else I can do, or is it something that's in the small intestine that's causing the problem? Or should I go and have it checked out? Sorry, doctor, I know that you're not doing consultation, but I'm just saying, would it be worth me going to have a check to see if my small intestines are okay?
All right. You've done very well, Grace. And blessings unto you. I think try introducing probiotic into your diet. It may be that you have you still have the wrong kind of bacteria in your stomach. If the bloating is coming from your stomach, if the gas is coming from there, because you're not supposed to have any bacteria in your stomach. So go on a probiotic daily, especially if it's something like sauerkraut, rather than the pills that they have, okay? Because sauerkraut really helps with bloatedness. So go on that, put it in your green salad and eat it regularly. Try that for a couple of days and see if that helps. If not, then like I said, it's always good to try and identify what is the cause. But considering everything you have done, and I know Lucille would have done a thorough job, just try and introduce probiotic if that has not been done yet.
Thank you very much. Thank you.
Thank you very much. Just to repeat again, that we're not doing a consultation. I know it's very, very tempting. You think, well, I've got the doctor. I've been trying to get the doctor for so long. It's there, and I've got to get. But still, be mindful of other people. We're not doing consultations. Dr. Louise, are you happy for you to give your information that if somebody wants to have a consultation, they can contact you at a later date? Are you happy to do that?
I want to be honest because I find it difficult. My workload, that's why I try.
Sure,
I try to answer, and the questions they have asked, I think they have helped others. I think others who had gas were able to. You can give out my details. Just please kindly be patient. We do have a very heavy workload, as you can imagine. So just I did say that our turnaround time was quite high. And after I read your question, if I think somebody else may be able to help you, I will direct you. I will send you somebody's contact details to be able to help you. But yes, absolutely, you can, just as long as people are patient when they send their questions.
That's great. Okay. Charlene, have you got any question in the chat? Or on
there is one. Well, there's quite a few. So I'm going to the top and I'm trying to read down.
Well,
so
if you do a couple on yours.
Okay.
And sorry, Charlene, I see that there's Lorraine. She's actually lifting up her hand physically.
Lorraine.
So
is
just
she?
mind her as well. Yeah.
Okay.
I'm so sorry. I just have one simple question. You mentioned about the Super M. I've got the powder and I've been using it on my like my smoothies. Can I use the powder in a tea form, and how do I do that?
Just have a look on the instruction form, Charlene. Can you? I think you should be able to. It would make a thick powder. But I'm actually not sure. But I don't
the
see why
powder?
not, because it's the bark, I think, that has been dried and then it has been crushed into powder.
Yes, the powder you can use. I know there's quite a few questions about the slippery elm, the powder, and you can use it, but you have to be mindful regarding it because it will become too thick and it will just not taste very nice to drink. So only a little bit in water, warm water, if you're doing it as a tea.
Thank you very much.
You're welcome. There is a question about, I think you did touch on this, Louisa, regarding bloating. Someone's having constant bloating. But I'm sure you mentioned that in your presentation before. I'm not sure if, I don't know if you wanted to still go over it. But someone's asking regarding bloatedness all the time, constant.
Well, like I said to Grace, it could be, bloatedness is gas somewhere in the intestinal tract. So it could be because of bacteria, it could be because you swallowed some gas. So charcoal helps because it absorbs the gas, and also going on a good probiotic like sauerkraut, which is fermented cabbage, also helps with bloatedness. So that's something people can try. And also, like I said, just good eating habits, closing your mouth, not talking and eating at the same time so that you're not swallowing large amounts of air, and not keeping the gas in, appropriately making sure that it leaves your system, because that can be very uncomfortable.
Thank you, Louisa. And there's another one regarding, someone asked, what causes you to feel that food travels down the esophagus, but it feels like it's getting stuck in the base of throat, in between shoulder blades? So that sounds like maybe guess, but they're asking which test should one ask the doctor to do regarding that? So it's food traveling down the esophagus.
Yeah. If you go to your doctor, just tell him those symptoms, and your doctor should be able to decide what test they're going to do. Often they start with a barium swallow because that's non-invasive. It's an easy test, so they can see where the problem is, where things get stuck. And then after that, they may do, if they think that there's a lump, they may do an endoscopy to have a look and to see. Then after that, they may decide to do a manometry. But it would depend. If your doctor doesn't think, if the doctor thinks they can jump to a certain test because they have a suspicion that it may be something else, they will make that decision after having asked you several questions, especially if they're balancing resources. You can't do all 3 tests because it's going to be expensive. Then your doctor will decide, having had, but you should not have the feeling of food being stuck as it moves. You should not even be aware of it as it moves down. Yeah. So definitely you need to go and see your doctor so that you can be investigated further.
Thank you, Louisa. Another question is, what can be done with an overlapping bowel?
An overlapping, the hiatus henia. I think that's the hiatus henia, where part of the stomach moves into your chest cavity. Well, if you lose weight, things will move back into position. My doctor back then, about 15 years, recommended that I have an operation. I kindly declined, and my system is back to normal. So you just have to, like I said, as you make the lifestyle changes, your body will start to do the restoration. But I do know that some people, it is severe and they do go for an operation, and it gets put back, and then things get replaced. But you would have to see the severity of the condition, speak to your doctor, and remember, when you discuss with your doctor, ask them about potential complications of what it is you're doing, so that you don't repair one condition only to end up with another condition. But often it can resolve itself.
Okay, thank you. Someone's talking about spices as well. So they say, how about spices? I'm not sure what they mean, whether using spices and acid reflux. But I'll probably
Yes, it would depend, I suppose, the kind of spices people use. You know, Shailene, you and me, when we talk spices, we're talking different things. We're talking about cumin and sage and things that you know help and support the body. But other people are talking about chemicals that are done. So there are spices, especially the spicy things. They really like your curry powders and things that are very heavily hot, that can cause irritation. Let me rather say they can cause irritation to the system. So you would want to avoid those, okay? Because already, when you eat them, you really don't feel very comfortable. Actually, your whole digestive system, when you go to the toilet, you realize what you ate is having an effect. So avoid those kind of things. That's when I said avoid any exacerbating factors, and then use your simple herbs and spices. Like I said, your cumin, jeera, your corianders as part of your seasoning. Those will have benefits to your body rather than harm.
Okay, thank you. Edgar, I'm not sure if you want to take over the hands. I'm just going to go.
Yeah, I've got Ria. Do you want to unmute and ask your question?
Sure. Hi, good morning. So I just wanted to ask a quick question. So someone I know, they're afraid of eating the solid foods because of the pain after she ate the solid foods because of that stomach condition she had that the doctor said it might have been an ulcer or H. pylori. So what are some tips on recovering from that? I mean, in terms of the foods that she can eat so she don't feel that pain, because not eating solid foods can cause you to lose a lot of weight, in which the person did. So what type of food can that person eat and not have to worry about feeling that pain or being fearful of even starting back to introduce solid foods in the stomach?
Yeah, so they would just literally follow the program that I said. They would be drinking the aloe water, which will help coat the ulcer and soothe the inflammation. For a week or even 2 weeks, like I said, my other patient was on a very restricted diet for a month to allow the healing to happen. They could be eating pawpaw and eating oats. That is going to start the healing process. Eating foods that they know doesn't hurt them. Then they start introducing one item at a time. Okay, so they would introduce whatever, your barley, whatever other foods that they know is not really harmful. I just create a list for them and I say, okay, you start with these foods, then you introduce these ones, and then you introduce these ones. So they just start with the law of addition, avoiding the ones that are very obvious, the citrus and the heavily spiced and the fatty foods too much, until they get to a point where they're able to eat a lot of the foods without having that discomfort. So they just introduce one thing at a time and until they get comfortable, and then another thing. And for about 2 days, every 2 days, they can introduce something new. And they can have soups as well, as a form of a broth, or blend it up so that they're not losing weight. Adding some avocado to, if they're having bread, they can toast it. It becomes a bit easier. Toasted bread with avocado, that can help if they don't have any gluten issues. Those are some of the principles that you can apply.
Okay, and you mentioned charcoal. Is taking charcoal every day too much that someone could end up in a worse condition? I mean, you mentioned charcoal to soothe the stomach, right? But how much should you take? I mean, in terms of, do you have to take it before every meal, before you eat?
Like I said, be careful with charcoal because it can cause constipation. So if they're drinking aloe water, that will also help without creating that. If they're having slippery elm, and like who was adding it to her smoothies, that can also be helping them. So there's no reason for them to have that fear, and you don't need to depend on charcoal all the time. Like I said, I don't recommend anybody taking charcoal for more than 3 days in a row. I don't recommend taking charcoal, more than 3 times in a day, especially if you're not eating other things that have fiber in them. It can create constipation. Obviously we're different, but just they must be mindful of it. I say take charcoal when you're in acute pain, and because it helps, it almost gives like immediate relief, especially if you have pain and you have bloatedness, it would help with that.
Well, thank you so much, because I had a friend that was taking charcoal every day, as if it was just like a vitamin or something, until she found out that was wrong. So she stopped.
All right.
But thank you for your advice. Thank you.
Pleasure.
Okay, thank you. The other thing I would say, Doctor, is my understanding is that depending on when you have your charcoal, it actually can take away your nutrients. So if you're having charcoal excessively, you're working against the body if you're having charcoal too often. Would you agree?
Yes, absolutely, because it absorbs things to itself and takes them out of the body. So you want to use it as a therapy, it's not food. It's a therapy, and for a short period, you use it and then you leave it. That's why things like aloe and your slippery elms will then come in to continue the work of healing. So yes, thank you for that. And remember, everybody, it's not a one shoe fits all. People are different and they respond differently, and their conditions present differently. The severity is different, and there are other factors that apply. So that's why I like to present the principles, so that even for yourself, when you're looking, how you deal with yourself and how somebody else is going to deal with it may be completely different. Understand the principles and apply the principles, and be holistic. Don't just take slippery elm, but you're still doing the other things. Implement as much of it as possible. Like I said, yeah.
Thank you.
Follow the principles.
Okay. The next question I've got, Patricia. Would you like to unmute and ask your question? Patricia, would you like to unmute and ask your question?
Taking a while to do that. Thank you for the presentation, really good. There was a question in the chat as well about burping. Should we be worried if we burp a lot, or is that just quite natural?
I can't hear you, Patricia.
Shall I write the question in the chat?
I'll repeat the question. She said, if you burp a lot, should you be concerned? If you burp a lot on a regular basis, should you be concerned?
Well, yeah, that's an exchange of gas and food, and you should not really be having so much gas in your stomach. So yes, you need to look at why that is. And often we see it in people who have stomach issues, right? And then they go, especially on treatment, antacids, and then they develop H. pylori, which is a bacterial infection in the stomach. And so then they go back and forth with this regard. So you have to be consistent in terms of your treatment, like I said, because you need to get rid of that bacteria. It's not supposed to be in there, but what keeps it out is the acid, but the acid causes pain. So a lot of people kind of need help. But if you follow the process really, and the principles, and you just do it consistently and understand that that's not supposed to happen. You have gas there that's not supposed to be there. Maybe you take a little charcoal, then you take some aloe, you take some slippery elm, you start introducing foods in the right orders. You should get to a point where it gets better. So yes, you should not be burping all the time.
Hello, sorry. Is it all right to answer your question on behalf of my friend who tried to log in? So she sent me the question. Is that all right?
Okay.
Yeah, she was saying what herb or nutrients can she use to tighten the sphincter muscles? Is it SPHINCTER?
All right. Yes, I had the question. The lower esophageal sphincter is a smooth muscle, like a lot of other muscles. Your body is responsible for maintaining your muscle health. All right. So what you want to do is, like an elastic band, you don't want to damage it. So as you leave these health principles, your body is able to do a work of restoration and repair. I know they are looking at, they're starting to introduce things called prokinetics, but it's in the form of medication where they're trying to strengthen the lower esophageal sphincter. But the body is able to do all of that for itself. It's like if you drink your teas, especially women, that we use for, like, your black cohosh, you know, it might not specifically be said to treat the lower esophageal sphincter, but I do know that it works on strengthening the uterus as a hormone balancing tea. That would also help. So her focus should not be on trying to strengthen the lower esophageal sphincter. Everybody should focus on making sure that they don't insult the lower esophageal sphincter, because it's created and designed to be able to contract the way that it contracts and release the way it does. The only reason it goes otherwise is because of the lifestyle that we do. And that there is a point beyond which, as I was doing my research, that it becomes very difficult to repair it. Does that make sense? So tell your friend that it's important to remove the things that insult the lower esophageal sphincter, that smooth muscle. So by eliminating all the things we mentioned and living this lifestyle that allows the body has an intelligence to know how to do these things. It will release the nitric oxide, it will release the acetylcholine. This is one causes it to constrict, one causes it to relax. That's what the body does. So, but you want to make sure that it is not damaged. It does not have scar tissue, because then it becomes difficult for it to respond. So unless you have complications, the body should be able to bring it back and repair it when you apply these lifestyle principles.
Okay, thank you so much, Doctor. Thank you.
All right, Carol.
Okay, Sharon, you can go ahead with the question.
Okay. Good afternoon. I'm asking. Continue. Right. I'm asking.
Hello.
Yeah, sorry, I'm trying to speak. Yeah, I'm asking this question on behalf of somebody else. Right. She missed the bit when you were talking about pregnancy. However, she's asking, right, since early stages of pregnancy, or 17 weeks really, unable to eat or drink or take prenatal vitamins, and she's asking what can she use for reflux and indigestion. And she noticed that you mentioned peppermint, but she says as a pregnant woman she cannot have peppermint. So what could she take for her reflux and indigestion? Struggling a bit with morning sickness.
Yeah, so you see, in that state, her condition is mostly from the morning sickness. So ginger is something that really helps in that condition, because unfortunately in pregnancy, the hormone of pregnancy, progesterone, also causes the relaxation of the lower esophageal sphincter. So she can try some ginger. She can just drink the aloe water, things that are going to help ease the discomfort. As I said, once the pregnancy goes away, then she'll be fine. So she can drink, somebody was asking about aloe, A-L-O-E, not A-L-U. It's A-L-O-E. Then you can Google it and see what it is. Drink the aloe water. She can take a bit of charcoal. If she's in severe pain, she can take ginger. It should be able to help both the reflux and the nausea that comes with pregnancy. And otherwise, if not, some people have, especially if they're pregnant with twins, it can get severe. They may just need to also go into the hospital, get rehydrated. In a little while, she should be able to get over that phase, especially the nausea.
Okay, thank you very much. That's great.
Shirley, do you have a question?
I do. Someone's asking, they get chest pains every time they eat. What will be the reason for this? Chest pain every time they eat.
It could be reflux. It could be that there's a problem with the esophagus. So that's why I say it could be what they're eating is causing, you know, the blood vessels to the heart to constrict. I'm not trying to scare you. That's why I say it's always important to consult and find out what is happening. Remember, reflux can present almost, some people think that they're having a heart attack, but it could be reflux. So you would need to consult further, because I would need to find out other information. What's happening? What other conditions do you have? What is your size? And all of these other things. What medication are you on? You know, to get a better picture, so that the right diagnosis can be given, so that we know what treatment needs to be implemented.
Thank you, Dr. Louisa. There is one more that I just saw, and that will be the last one for me for questions. Someone wants to find out, how do one know if they have irritable bowel syndrome? Someone has movement in the stomach. Could it be also parasites?
All right, I think we will save that question for when we cover irritable bowel syndrome. Here, irritable bowel syndrome is a diagnosis of exclusion. When we can't find anything else, then you have irritable bowel syndrome. So that's going to that requires a whole presentation in itself to be able to understand it. Yeah, unfortunately, sorry.
Charlene, can I ask a very quick question?
Yeah, that's fine, Barbara.
I put my hand up. Yes, thank you, doctor, for the presentation, and good afternoon, everyone. Yeah, I would like to ask about the omeprazole. That is one of the treatments for reflux illness. And what do you think, doctor, about this medication? Because I heard that someone told me that the cilia that are responsible for moving the food along the digestive tract can be damaged by it. So I wonder if it's wise to take it or not really.
You're trying to get me into trouble there. As a medical doctor, I'm supposed to tell you to take omeprazole. That is what my training does. But you can just have a look at the insert to see the side effects of the medication. That's why I said today I'm talking to you about the non-conventional way of dealing with this issue for those people who want to do away with it. If you're going to take omeprazole, which is, it stops your stomach from making acid. That's what it's designed for. Is it going to give you relief? Absolutely. I know, I used to be on it, you know. So now you feel the relief, you think you're sorted, but now you're not making acid. If you're not making acid, you're not able to break down amino acids. You're not able to break down proteins, and you're not able to absorb vitamin B12. And if you take that antacids, you create an environment in your stomach where the H. pylori bacteria can grow, because you see the acid would otherwise destroy it. So when you're taking the omeprazole, all you're doing is you're trading one condition for another. Medication does not cure, okay? We as doctors, we're not trained to cure you. We are trained to manage your disease and relieve you of your pain. What TTI and what other doctors are starting to do is say to you, okay, if you don't want to manage the condition, if you don't want to do away with acid reflux and gastritis only to have H. pylori and malabsorption disorders, then you need to look at the cause of your condition and start making lifestyle changes so that your body is able to function the way it's designed to function. There's nothing wrong with having acid in your stomach. You were designed to have acid in your stomach. Your stomach is designed to be able to deal with acid. The problem is that we live lifestyles and eat foods and do things that interfere with the body's ability. I need to just change to my other thing, because my battery is running low and I'm far from a charger. So bear with me. as I switch devices. But I hope that answered your question.
That answered my question, yet it's not only acidity, but it's also an inflammation of the opening of the stomach, and it's chronic. So I wonder in that case if it's still all right to do that and not to take a medication.
Let me switch to the other device as
yeah.
Can you hear me?
Yes.
Yeah, we can hear you.
All right. If you're already on medication, what you may want to do is you may want to start making changes. Okay.
Excuse me, I'm not on the medication. I'm sorry. It's not it meant to be a general question, but it's kind of, yeah. I wouldn't like to get against the rules, but no, I'm not on a medication now. I took for a while this omeprazole, but then I didn't because I'm mindful of natural methods rather than medication. And yet, can it be caused by stress?
Oh yes, absolutely. I did mention that that stress, and we all go through levels of stress. Stress is going to affect your digestive system. So it's important. I think we have done presentations on stress, how to deal with stress, and the herbs that one can use to deal with stress. That's why it's recommended that if you are anxious, don't eat because you're not going to release the digestive enzymes to be able to digest and break down the foods properly. And this can lead to digestive issues as well. But obviously you cannot be eating. So we need to learn how to manage our stress. I highly recommend everybody have ashwagandha and be able to drink it. It lowers the stress hormone and helps you know, with the digestive issues if they're caused by stress. So
excuse me, what is ashwagandha? It's the first time I hear
it. In the chat, you would have to look it up and see where in your locality you would be able to find it. Yeah.
Thank you so much, and your presentation and your answer now have inspired me to actually really start looking, introducing of what you said today, and hopefully this will release the situation and relieve the illness.
No,
okay, thank you. We're going to go to the next
much.
question. Thank you. We're going to go to the next question. Rosemary, would you like to unmute and ask your question, please?
Okay, I want to say to Doctor, thank you for the presentation, and it's very interesting. Concerning those who have cancer and those who go through chemo, by the way, I heard that chemo makes things worse, and then I hear that the disease that they had came back. Is there any other alternatives that they can avoid chemo?
So the point of chemotherapy is to destroy the cancerous cells. However, it also destroys rapidly dividing cells, which includes the cells of your digestive system. So that's why the people end up with nausea and vomiting and digestive issues. Okay. Now, when it comes to alternatives to chemotherapy, I recommend that you go onto the TTI YouTube page and have a look at a time. I think we did a 3-part series on cancer, because then we explain in detail far more than I can explain now. I don't want to say to people, don't take chemotherapy, but you don't have a holistic picture. So we have covered alternative treatments to chemotherapy. I recommend that you watch some of those. But yes, definitely anybody on chemotherapy, their digestive system is going to be affected. But luckily, the cells of the digestive system recover in about 3 to 5 days. If it's mild. Obviously, if the deeper the damage has gone, it may take a little bit longer, but they tend to recover because they're designed to be dying all the time because of the high frequency and the high level of intensity with which they work. So yeah, implement the principles, watch the videos on treatments of cancer, and hopefully you'll be able to find a help and solution there.
Thank you.
Thank you.
I think it was in November that we did it. So just go there and do TTI, T-Conference International YouTube, the cure for cancer or something. I don't remember what we called it.
Okay, I'm not quite sure, but obviously there is 3 programs that you can go on YouTube, our past programs, and find that information. I've got Louise Mercy's door, I believe. Do you want to unmute and answer your question?
Thank you. Hi, Doc. It's Louise here. Hi, Edgar.
Hi.
Hello.
Yeah, that medication you was talking about, the other lady was talking about, the Omo, whatever, you can't remember. I can't remember how to pronounce it. I have to say that I find it to be a very horrible medication. That's my own personal, I'm talking personally. I'm not talking about everybody and saying everybody don't take it. I'm just saying I find it to be a very horrible, destroying medication. I was on it for a period of time. And in the end, I had to actually it was many, many years ago, and it caused me so much other health issues, especially in my stomach. It caused me a whole lot of problems. And in the end, I just had to remove it totally out of my system for me to get a little peace. But it caused me to be so ill. So, if people who have been prescribed this medication, they maybe want to try looking at some natural alternative ways first before going down that route of actually taking that medication, because the effect that it had on me and many others, I know that it was very, very awful. So maybe try the alternative routes as been suggested instead of going down that medication route.
Thank you for sharing that, Louise. Yes, absolutely.
Thank you so much for your testimony.
Okay. It's a question. I think it's a very good question. It's on the chat and it says, can medication still be taken together with aloe vera and slippery elm?
With aloe vera, yes, it should be all right. And the slippery elm, I haven't seen any major contraindications in terms of the medication. With charcoal, you would just need to be careful because it will absorb the medication and it will not be absorbed into your body. But I don't think there's much in terms of interactions. Maybe calcium, because slippery elm is high in calcium, but I don't know what effect it would have on blood pressure medication. There's blood pressure medication that's calcium channel blockers. So, but these are the things you can just easily Google. You can say slippery elm and whatever medication you're taking to see if there's any contraindication, and you would be able to find the answer.
Okay, thank you very much for that. Shannon, have you got anybody? I think we're going to come to the close now. I think I'm sure you must be getting thirsty, Dr. Lee. All this talking, but I really appreciate the information and the advice that you're giving. Could I just ask you one quick question? And that is, I know you mentioned aloe vera quite a lot, so I'm presuming that there's a lot of benefits from putting aloe vera into your diet. Could you just expand on that a little bit?
Well, specifically for the acid reflux, it's because I have really found it very beneficial to the patient that I treated who had severe gastritis. But it has quite a number of minerals. If Jason is around, I know we were talking about it just last week, and he went into the details of the effects of aloe vera taken internally in terms of healing. I can't really go into as much details. My field is more anatomy and physiology, and I find these herbs. But I do remember him mentioning some minerals and some vitamins that aloe vera also has over and above its ability to heal the digestive tract. So yeah, sorry, I can't give more information than that.
I have one question. It says here, is slippery elm suitable for lung infections?
It's not really an antibacterial, antifungal, or anti anything like that. For lung infection, that would need different management program altogether. You know, I don't like to just tell people, oh, you've got a lung infection, take this. My question is, why do you have a lung infection? You know, where was your immune system when your lungs was getting infected? And where is it now? So that, you know, and how strong are you? So that I don't tell you to go and take echinacea, but the amount of infection that you have and your CD4 count is like 2, so you are left without defense, and that is not sufficient. You may need extra help. But no, slippery elm was not specifically for infections. When you look at its properties, it's not really for that. Sorry.
I think, thank you very much for that. I think we are about at the end. Shirley, is there anything that you want to add?
No, just the if those who's not on our Telegram groups, it's in the chat. And also remember Dr. Louise's challenge of the slippery elm tea. But Dr. Louise, could we also add sauerkraut into our challenge as well?
You know, yeah, that would be great, because I'm hearing that quite a lot of people have bloatedness. But apart from bloatedness, you know, a lot of people don't have the good bacteria, and perhaps that is a topic we need to revisit again. People don't have the good bacteria in their gut, and this also contributes to levels of anxiety, and anxiety actually contributes to reflux issues. So yes, I make sauerkraut, so I have it almost on a daily basis in my diet. So if you can get sauerkraut, if you can make your own sauerkraut, please, by all means, introduce that into your diet. It is very powerful. It's going to add the acetic acid to your stomach. No, it will not hurt you, even if you have this condition. All right, it will actually help and be healing. So Charlene just added another challenge, but it's a delicious one.
Sorry, everyone. But yes, once we so those is on our Telegram groups, we could talk about the sauerkraut and even how to make it as well. So very easy to make. And we can have our delicious sauerkraut and greens. But thank you, Dr. Louisa.
Yeah, I was just about to say that. Could you post it, like when you guys do it? Could you post it so we see how it's made, please?
That's fine.
All right.
Dr. Louisa, are you making any this week?
Yes, I will definitely want to try it.
Yes, that's fine, Serene. We'll do that.
Okay, thank you.
You're welcome.
Right, thank you very much. Thank you very much, Dr. Louisa, for the presentation.
A quick question. I've raised my hand, but before you go.
If it's very quick, very quick. Yeah.
You just mentioned acetic acid. I'm not sure, but is acetic acid, is that vinegar?
Okay, the process of making sauerkraut will result in acid, but not like the industrial vinegar that is made. Does that make sense? So it will not have the harmful effects that the industrial vinegar would have on your system. That's why it's different also with apple cider vinegar as opposed to your white vinegar. And so your fermented foods will have that good level of vinegar to improve the pH of your stomach, which is supposed to be acidic. So it will not harm you, Janet. That's what I'm saying. But obviously, if your reflux is really bad, it's better as sauerkraut than taking even an apple cider vinegar on its own, because in sauerkraut it's combined with the cabbage. It has high levels of vitamin C, and it has fiber, and it has a lot of other things, and you can mix it with avocado to kind of deal with the burning sensation. So I found it very, very, very effective in dealing with people who have digestive issues, the sauerkraut. I don't think I've ever had anybody, no matter how severe their digestive issues were, who was not able to take the sauerkraut.
Yeah, thanks for that. I don't really have digestive issues, but I was just wondering with regards to the counsel given by Sister White with regards to vinegar, and just remembering, I think acetic acid was in fact vinegar. So I just wondered with regards to, you know, the recommendation to have sauerkraut, and you know whether that sort of fell in line with you know, the counsel by Sister White.
All right, yeah, it's like salt and salt, isn't it? There's white table salt that is industrialized and it only has sodium and chloride and maybe some iodine. And then there's natural salt as it exists in nature, which has far more other minerals. So we must remember that for most things that are good for us, there's also a counterfeit that is very dangerous for us. There's juice that we talk about and people buy store-bought juice, but there's juice that you can make that can have healing effects on the body. So that makes the difference.
Okay, thank you.
Pleasure.
I think we're at the end, Shirley, I believe. If we say goodbye to our YouTube viewers, and again, I want Dr. Komatso for her time, and I'd just like to add the kind of response that we've got and all the questions. Please don't be a stranger. Please come soon to help us out.
I will really try, but literally every Saturday I'm doing a presentation somewhere, and even on Sunday, you know.
Sure.
Whenever
I understand that you're in demand. I understand. Just to do a quick ad. As I said, we're closing now. Next week's presentation is going to be done by who, Shirley?
Lloyd Maybury.
And we're going to touch on
influenza.
And I think it'll be a really interesting program. I think he's got something up his sleeve that he wants to share with everybody with regards to that. So if you have an opportunity to tune in, please tune in. Also in June, we've got like a block kind of presentation with Barbara O'Neill. She's going to be doing a weekend program on Saturday and Sunday, and also she will also be featuring on the 6th of June as well. So that's going to happen in June. I think that should be an excellent couple of programs. Is there anything else, Shirley, that we want to share?
No, for those who are interested in cooking classes, Alvin has one starting now, I think, or he'll have some more in the year, but some cooking classes, and then there's also the essential oil class on a Thursday, the spiritual Bible study on a Tuesday.
I'm just going to put the slide up one more time because, as I said, we're coming to a close. I'm just going to put the slide up.
Okay.
Just say goodbye to the YouTube listeners. Thank you very much, and hopefully we'll see you soon. Just for the benefit of everybody, we're going to put up a quick slide that you can see. Just hang on a moment. Go ahead, Shirley. You were saying something.
Oh, I was saying, so I'll start from the week. So Tuesday we have our spiritual Bible study on a Tuesday at 7 UK time. On a Thursday there's the essential oil class at 7.
Yeah, I'll put the slide up. Hang on.
Okay.
Oh. Carry on, Shirley.
Okay, and then essential oil class at 7. Edgar will share the link. There's Bible study. If you join the spiritual group, which is in the chat and the Telegram, you'll get the information regarding the Bible study on a Tuesday at 7 o'clock. The essential oil link is will be coming shortly, and then on a Saturday we have our program, which you have all joined us on today, and we thank you so much for joining us this afternoon or this morning, wherever you may be, or maybe even be evening now or night. So we do thank you for joining. So this is the Zoom details. That's for the essential oil class if you wish to join. Next week, we will be talking about environmental health outside. For the past 2 weeks, we talked about environmental health inside and how it's actually worse inside than it is outside. But there are recordings for these if you wish to listen to it. And then next week will be the outside outside environmental health. So these are the details. These are our Telegram groups, link groups, for you to put in URL for those who are on YouTube, and then you can join us where we'll talk about the sauerkraut. I see some recipes are in the chat. Sauerkraut is a probiotic, and what it is mixing cabbage and water, rubbing it together and leaving it. Some people add beets, some people add carrots, some people add caraway seeds. You can add quite a few other things to it as well, to your sauerkraut. But we can share some recipes on our Telegram groups. So please, if you're on Zoom, please click on the link that's in the chat. If you're on YouTube, please type this into your URL. But please ensure you do have Telegram.
Charlene, for a cooking class, do we need to have Telegram or can we just join without Telegram?
On the cooking class, if you go to their website, goldenpalmscookeryschool.com, the information should be on there where you're able to inquire. But it will be on Zoom, the classes.
And when, which day?
To be honest, I'm not quite sure, Barbara. I'm not sure if Louise is on or Alvin.
So I will go to their website and it will tell me, I believe. Thank you so much.
You're welcome, Barbara. So this is their details. goldenpalmscookeryschool.com. And the telephone number is 079-58-620-928. And the website should have all the information that you need regarding upcoming classes. Thank you, Edgar. Oh, and this one, I spoke about this one. Yes, thank you. So tomorrow there is another program. Well, it's a launch, I should say, because it's not all the time. It's a launch regarding this association and its Association of Health Reformers. And you will see some familiar faces on there as they have spoken on our TTI Saturday show. We have one coming up very soon, Dr. Sam Davis, so he'll be coming up very soon, I think in 2 weeks' time after Floyd, speaking on our platform. So they will be launching tomorrow at 4 p.m. UK time. But unfortunately, I don't have my phone, so I won't be able to tell you the Zoom links. I don't know if you can share it out, please, Edgar, the Zoom details, as I can't see on my screen.
I can see, but the ID, oh, okay, there's no pass required. And the ID is 894-432-1359. I'll say it again, 894-432-1359. And the time is from 4 p.m. to 5:30 p.m. UK time.
Thank you, Edgar. And actually, we will be having Marcia on the TTI program in July. And I know we've been talking about herbs as a challenge, and Marcia will be actually doing some demonstrations and talking to us further regarding herbs, as she's a medical herbalist. So yes, and Geraldine has spoken on our women's platform as well. So it should be an interesting launch for tomorrow at 4.
Okay, thank you very much, Shirley. I believe that we are now kind of...
Oh, sorry, Edgar.
So you've got something? Go ahead.
Sorry, I'm confusing everybody. It's not cabbage and water, it's cabbage and salt.
Okay. I think there's a bit of a difference there.
And it makes its own water.
There's a bit of a difference there, but there you go.
Yeah.
Okay, we're kind of at the end, and we want to thank everybody for joining in for our show. We want to say, please join us back next week if you can make the time. There will be a wonderful presentation again. Please have a fantastic week, as we're going into another week, and we're saying goodbye to our YouTube viewers.
Yes,
We'll see you
thank
next
you.
week.